will the penile implant decrease or otherwise change my sensitivity? In short, the answer is an emphatic no, but there is some nuance here that deserves discussion. What's up guys, Dr. Alex Tatem here, and welcome back to Hard Facts Episode 5. This is our dedicated series focusing on ED, penile implants, and everything else related to the penis. Today, we're answering one of the most common questions that we get from patients, which is, will the penile implant decrease or otherwise change my sensitivity? But before we get going, take a moment, hit that thumbs up button, like, comment, subscribe, and click that notification bell so you know when we drop our next episode. Every click is a huge help to our channel, and as a token of our appreciation, here's a picture of Tom Cruise pulling a barrel roll on an F-18 Super Hornet. Now that I'm thinking about it, answer us down in the comments. Which was the better cinematic experience, the original Top Gun from 1986 or Maverick? So does the penile implant change sensitivity? In short, the answer is an emphatic no, but there is some nuance here that deserves discussion. First off, I like to break down the male sexual experience into 4 key components. First, there is sensation, which is to say when someone touches your penis, you can feel it. The second is erection, which is the filling of the erectile bodies, the corpora cavernosa, with blood to the point that they become rigid enough for penetration. Third is orgasm, which is the chemical rush of dopamine that you get with climax. This is that feel-good peak of sex. And finally, fourth is ejaculation, which is the physical contraction of the pelvic muscles combined with the expulsion of fluid, aka semen. As guys, we tend to think of these individual processes as one thing because, when we're young, that's how it all works. One thing follows another. But each of these 4 processes are actually quite separate. For example, men with ED or impotence can still feel their penis and even reach orgasm with ejaculation even though they can't get an erection. And men who have had their prostates removed for prostate cancer can reach orgasm, but they won't ejaculate any fluid because that internal plumbing has been removed. So when we're talking about placing a penile implant for ED, we are only addressing the issue of erection and getting a hard, penetrating penis for sex. We don't do anything to affect sensation, orgasm, or ejaculation, either positively or negatively. So if you can reach orgasm and ejaculate prior to your implant procedure, you should be able to afterwards. Now, time to get into the weeds and talk nuance. Every time we do surgery, there are some sensory changes associated with the incision. Our skin has invisible nerve endings that get severed with almost any significant trauma or cut. This most commonly leads to some temporary numbness around the incision. With our preferred incision, the peniscrotal approach, our incision is far away from the penile shaft, which protects the penis from this temporary numbness. But even this incisional numbness is temporary and resolves with time in the majority of patients. Now, the nerves that truly supply sensation to the glands run along a structure called the dorsal neurovascular bundle. This runs along the 12 o'clock position of the penile shaft and is miles away from where we're working with the peniscrotal approach. Injury is possible with the infrapubic approach or with complex Peyronie's work at the same time as implant placement, but experienced dedicated implanters are especially trained to avoid this. A second bit of nuance is the erotic sensation that men feel inside their penis with sexual stimulation. This is separate from topical sensation, and when men are younger is typically associated with the gradual onset of erection. This is preserved with the implant. Even with an implant, men still feel that erotic sensation and rush with stimulation. In some cases, because we use a minimal dilation technique, men will even still experience a partial erection with their device in place. However, in order to get a full, rigid, penetrating erection, men will still have to inflate their device, which is fine because that's why we're placing it to begin with. The third and final bit of nuance has to do with what's changed while a man's been on the sidelines with ED. As we age, sensation and orgasm change, and these changes can be missed when men aren't getting erections and having sex, and their partners' bodies may be changing as well. So sex may feel different than what some couples remember, but that's okay. I often joke that this is a new chance for couples to pretend they're high school kids all over again and they have to figure everything out. I mean, what could be more fun to practice than sex? So I hope that gives some peace of mind to you guys who are considering an implant as a permanent solution to your ED. So if you like this content, please like, comment, subscribe, hit the notification bell for when the next episode drops. And if you want to see us and see if you're a candidate for an implant, check out the links in the description down below. Until next time, this is Dr. Alex Tatem, signing off.